Tēnā tātou katoa. Good evening. The nurses' organisation is warning more people will die if the healthcare sector's staffing crisis isn't urgently fixed.
An investigation is underway after a woman died at Middlemore Hospital yesterday. It's claimed they'd earlier left the emergency department because of long wait times. Because, as Alexa Cook reports, hospitals are full to the brim.
David Walters is finally back home after collapsing on Tuesday from a suspected heart attack. He was rushed to Middlemore Hospital but spent more than a day in the ED waiting room.
It was at least 32 hours before I even got a bed. So
a temporary bed set up in a doctor's office.
You know, the hospital's just so full, they've just got nowhere to put anyone.
Other ED patients gave up waiting.
There were some people that were actually, sick and just decided to leave because they didn't want to wait there any longer.
But an urgent investigation's underway at Middlemore after claims a patient left its ED due to long wait times, only to return 3 hours later and die from a brain bleed.
We've actually been predicting that this is going to happen. I'm not the only health professional who has been doing that.
Emergency doctors have been telling Newshub hospitals are so full that people are being treated in hallways and ambulance bays.
There is more chaos because effectively the departments are overcrowded, so we have patients everywhere and it's really difficult to do a good job in that situation.
And the shortages of health professionals has come to such a point that we know that people are going to die simply because we cannot do our job in a safe work environment.
But the Health Minister says he's doing his best.
We've added 4,000 nurses to the nursing workforce in the time that we've been in government, looking at increasing nurse pay, so we're doing everything that we can.
But healthcare workers at Palmerston North Hospital have had enough. They've given managers a week to fix overcrowding and excessive workloads.
And they're very, very worried about making a mistake. And in this context, mistakes will be made and lives will be lost.
Though Mid-Central DHB says the issues are already being addressed, while in Christchurch its hospital is at 107% capacity and cancelling most elective surgeries.
The concern across the country is the impact on our patients long term, but I guess our primary focus is how do we maintain safe patient care.
To ensure more patients' lives aren't put at risk.
Kia ora, Alexa. So the health system is buckling. Why is that?
Well, Mike, there's this perfect storm of a surge in winter illnesses. There's also this ongoing pandemic, plus severe staff shortages. And that's why the nurses' organisation is urging people to take care of themselves and try and avoid ending up in hospital. That includes things like getting your flu jab. And if you're sick but it's not life-threatening, then ringing your GP or Healthline rather than just turning up in ED. But on the other hand, the DHBs I've spoken to, well, they're quite worried that people might be put off by these wait lists and not go to ED when they need to. So they're wanting to reassure the public that hospitals are there to help.
Alexa Cook live from Wellington. Tēnā koe.